Welcome to Shape of the City. I'm Clover Frederick and I'll be your host. The Community Health Endowment of Lincoln recently released a report on a community mapping project called Place Matters, showing life expectancy in Lincoln can vary nearly 30 years from one neighborhood to another. Joining me today to tell us more about it are Lori Seibel, President and CEO of Community Health Endowment, and Steve Frederick from Lincoln-Lancaster County Health Department. Thank you both for joining me today.
You're welcome.
Now let's start with Lori. Tell me, how did Place Matters get started and what inspired it?
Well, you know, there is so much work being done in Lincoln to understand what's happening here and to understand our growing city. And so we just wanted to be able to get personal with the city and to take some of the work that's been done with other planning projects and go a little bit deeper. And so we chose to do that through maps.
Okay. Now, what was covered in the community mapping project?
Well, we looked at some of the traditional indicators of health, like healthcare coverage, whether or not you have access to healthcare. But then with mapping, we're able to look at where that access takes place geographically in the community. And then we were also able to look at what they call social determinants of health, things like poverty and crime.
Okay. Now, what were some of the surprising things you learned through this project?
Well, I think it's everyone's own impression of whether they were surprising or not. I think everyone's impression was different. Certainly people have focused on the life expectancy issues and the disparity that exists among our neighbors and our neighborhoods. But I think when you look at the causal factors associated with that, it makes more sense.
Okay. Now, who was all involved in putting together this report?
Well, it absolutely was a partnership between the Lincoln-Lancaster County Health Department, Steve's group there, and he'll talk more about them, I'm sure, and NeighborWorks Lincoln, who is such a strong working organization in the heart of our city, as well as the Urban Development Department for the City of Lincoln.
Okay. Now, let's talk to Steve a little bit. Sure. Tell us about Lincoln-Lancaster County Health Department's role in this project.
Well, actually it was my staff, Raju Kakralapudi, our public health epidemiologist, and Deb Byrne, our GIS analyst, who did a lot of the work on the maps. The speaker the other day said there's a lot of work that goes into these, so they spent hours and hours on working on maps that were requested. Once one map is made, it's amazing how many questions get asked, and so you start bringing in more and more maps.
Sure. Now, what did you find most alarming that helped you put this together?
Well, I wouldn't say anything necessarily that it was alarming. Obviously, there were some areas that were highlighted, like life expectancy differences. There's always going to be those high poverty areas and then the growth of poverty over time. As Lori said, those are some of the key factors for health. I mean, education in some ways is the key to higher incomes and also in being basically good consumers and taking care of your health. And if we find where areas that perhaps have the lower income, they also have lower education, and those factors actually have an impact long-term on life expectancy.
Okay, now how will this project inform the health department's programs going forward?
Okay, well, right now we're in the midst of a MAP process, which is mobilizing for action through planning and partnership. It's really a community health assessment. We're actually about 3/4 of the way through looking at the data, and we're also looking at what people's perceptions are of the quality of life in Lincoln, and then bringing in some of the partners to talk about how strong our public health system is. So we're using the maps to inform people in terms of the health status and some of the indicators, and then we will set priorities for things that we know we can probably do in a 3 to 5 year period, and that'll be part of our community health improvement plan, which is a process that we go through every 3 to 5 years.
Okay, very good. Now going back to Lori for a minute. So it sounds like there's several different maps that have been created. What do they all mean sort of collectively?
Well, like Steve said, there are maps that create questions, that create more maps, that create more questions. And so what we do have are over 100 maps. Mm-hmm. And when you start layering them, you can start seeing why certain neighborhoods are more impacted than others. It's not a single answer. There's not a single way to address a problem or an issue in a community. It's multi-factors. And so when we begin to see these maps and layer them, some of those things will become more clear. Some of them may raise more questions. That's what maps do. And so it's important to look at them in the context of not just one issue, but multi-issues happening at the same time.
Right, and it's not an individual thing, so individuals might have the ability to basically rise above whatever the level is in their own area. And like I said, overall, we are really doing very well on life expectancy. 80.1, which is the life expectancy for a child born in Lancaster, is really on par with some of the best outcomes in the world. Monaco is, I think, 89. And if you get to 80, you're doing really well. So it's just that as when we looked at the neighborhoods and we started looking at all those factors that are hitting different parts of Lincoln, it was pretty obvious that some things kind of coincided. Not always can you say that, though. I mean, in some cases you actually have good outcomes in one census tract, and right next door you've got really bad, and you kind of go, what's the difference here? Because they're not that far apart geographically. What factors are involved?
Yeah, and I think obesity is a great example of being able to look at an issue that has multi-factor reasons for it occurring in a particular neighborhood. But if we look at it overlaying poverty, for example, there's a strong correlation there. What it does as a community is it says we have limited resources. We only have so much funding, so many human resources to put into a particular issue for our community. So what's great about maps is it says now we know where to go and address it full force. We can say let's go there and really work at it hard in this particular neighborhood or in this particular census tract. And that's what allows us to spend our resources more effectively and our human resources more efficiently.
What's the next step? How are you hoping this report will be used within the community?
Well, the first thing we hope is that when people look at the maps, they see lots of opportunities. We do a lot of things really, really well in Lincoln. And I think when we set our goal as an organization to have the healthiest community in the nation, a lot of people thought, oh, how could that ever happen? But the fact is it has. We're on the top of many lists as being one of the healthiest, if not the healthiest city in the nation. So we've done some extraordinary work. So I think what these maps say is there are opportunities to get even better, and there are opportunities to look at how things other than health care impact our health. So for example, how does where you live or whether or not you have access to parks or good sidewalks, whether or not you feel safe in your neighborhood, whether or not you have adequate access to food or healthy food, whether or not those things play a role in it. So we're looking at beyond just looking at what happens in a doctor's office or what happens in a hospital, but what's happening in our neighborhoods and our schools, and that's really how we create this opportunity to make us even healthier than we already are.
Great. Now, where can the public go to learn more about these maps and this project as a whole?
Well, I would encourage everyone to go to our website, which is www.chelincoln.org, and you'll see there information on this project. We're hoping by the end of the summer to have many more maps up than we already have there, but there will be a chance to become interactive with the maps, to be able to look more specifically at issues that people in the community are interested in. And so if you go to our website, you'll find out lots more about the project.
Great. Well, thank you both for joining us. This is a really eye-opening project and I think a great tool for the community.
Thanks, Clover.
Thank you. When we return, we're going to learn more about how you can reduce obesity by what you drink.